Thank you so much. Welcome, everybody, to this Critical Conversations series. My name is Fiona Miller. I'm the director of the Collaborative Center for Climate Health and Sustainable Care, and I'm really delighted to welcome you here in person and online for this session. And before we get started, of course, I want to acknowledge where we are here in the University of Toronto. These are lands that for thousands of years have been the homes of the Huron-Wendat, the Seneca, more recently the Mississaugas of the Credit. These are lands that are subject to Treaty 13, the Toronto Purchase, and although we have not upheld those obligations, we are, as our colleagues in Nova Scotia say, we are all treaty people. That means we are all obligated to uphold treaty. And these are, of course, lands that are subject to the pre-colonial treaty between the Anishinaabe and the Haudenosaunee peoples in terms of the Wampum Belt Covenant to live together as one spoon in one dish. And these are, of course, the lessons that we, as we pursue more sustainable ways of living with the human and the more than human world, these are the lessons we need to learn and the practices we need to regain. And that's the context, I think, for this conversation. We, as the Collaborative Center, we're quite new. We've been in existence. We've had our second anniversary now, and we have a seminar series that really is defined through collaboration, through working with other centers of excellence around issues of interest to them. We have one coming up with CAMH, but we've also created this Critical Conversation series as a way to try and create space for the challenging issues. There's much that we can do, I think, to make change that aligns with current, policy commitments, organizational commitments, strategic norms, and standard operating procedures. But there's much that's required that goes well beyond business as usual. And as an academic unit, we need to create space for more innovative, more transformative ways of thinking and acting in the world. And so as a small effort towards that, we've created this Critical Conversation series. And I'm really delighted in that context that Dr. Zywert has agreed to come to speak with us today. Katharine is the author of Sustainable Communities for a Healthy Planet. That's her most recent book from 2024. I first got to know Katharine's work as lead author for Health in the Anthropocene, lead editor rather, for Health in the Anthropocene, Living Well on a Finite Planet in 2020. And you don't know this, but I was part of the U of T Manuscript Review Committee, and I was charged with that book. And I can tell you that talking to my colleagues from all these other disciplines in humanities and social scientists, really amazing scholars, and sort of talking about this book, what it was doing, how it was intervening, how reviewers had thought about it, it was really quite an interesting experience, because you were sort of saying, so here's a book that says, we will be post-growth, either because we will move in that direction or we will be forced in that direction. Then the silence in the room was really quite something to behold and to be part of. So Katharine intervenes in really powerful and important ways into the conversations that we need to have about community-based approaches to planetary health, the transition to a sustainable health system, and her own work, I guess personally, a lot of work on gardening for health and well-being. She holds a graduate diploma in social innovation, University of Waterloo, a master's degree in medical anthropology. Your PhD is in social and ecological sustainability from the University of Waterloo. So Katharine is really well placed to help us in this conversation. So over to you.
Thank you so much. I'm really thrilled to be here today. Thank you for joining. It's really exciting to be part of the Critical Conversations series. In my view, regenerating and sustaining planetary health is one of the most critical and complex challenges that we're facing in the coming decades. And for health systems, it raises a lot of wicked problems. And I think this series is an excellent opportunity to dive into some of the more paradoxical tensions that are kind of implied by those challenges, that as health researchers and practitioners, we don't really have the time to dig into these things as part of the daily grind. So today, I will frame some of the key characteristics of sustainable health systems in the Anthropocene as I see them, some of the challenges that we're up against, and then kind of think about what a sustainable health system that really can cultivate planetary health in a post-growth future might look like. So my research has focused on relational approaches to planetary health. And relational approaches are initiatives and ways of being that prioritize cultivating relationships as a way of building health and well-being. Relational approaches would tend to be more common in indigenous and traditional cultures around the world. In living close to the land, these cultures have an inherently more relational worldview. There's no escaping mutual dependence within ecosystems and mutual thriving when you've lived in one place for many generations since time immemorial. However, relational approaches in kind of dominant Western kind of mainstream society are at the margins. And this is because they really act and see the world in different ways that stand in opposition to the mainstream, which would be very much an individualistic kind of worldview, mechanistic, rooted in these imperatives to be always productive and profitable. But I argue that relational approaches, we need to be paying much more attention to them because they're the kinds of strategies that can actually help us to address the health challenges that we're facing in the Anthropocene. So I'm going to begin the conversation today with some foundational premises for how I understand health in the Anthropocene. Before I do that, a few notes about the concept of the Anthropocene. Most of you are probably familiar with it, but if you're not, the Anthropocene is the geological epoch of human impact. So it's thought to have begun around 1950, and it's the time when human activities became the dominant driver of change at the planetary scale. Human civilizations emerged and began to expand and really thrive in the Holocene epoch. And this was a time of climate stability, lots of fresh water, nutrients available for human societies, and a great abundance of biodiversity. And the Anthropocene, in contrast, is characterized by the climate crisis, rising temperatures, ocean acidification, and the decimation of biodiversity. And it's unclear what the prospects are for human health in these conditions. We really don't know how this is going to go. Another note about the Anthropocene is that because this term talks about human activities in general, I think we need to remember that we're not actually talking about the activities of all humans on the planet. What we're talking about is the activities of those people who live in a way that is not sustainable. So consuming more resources and energy and producing more waste and pollution than the planet can sustain. So at this point in our history, that would include most people who are living in high income and emerging economies, with the exception of some indigenous communities, some other communities, maybe like the Mennonites who live close to where I'm from in Waterloo. It would also include the activities of most corporations, with the exception of some social benefit and environmental purpose companies. So just to remember that those who are most vulnerable to the climate crisis are those who are least responsible for the dynamics we're now seeing in the Anthropocene. But returning to these three foundational premises, I am going to go over each one fairly quickly and then do a deeper dive as we get further on into the conversation. So first of all, human health is dependent upon planetary health. Really, planetary health encompasses human health. They're one and the same. As human activities have become the dominant drivers like climate change, biodiversity loss, soil degradation, and all of these other processes that are destabilizing the planet's life support systems and undermining the capacity of our planet to support. So as we seek to improve the well-being of our species by increasing material standards of living, we're unintentionally eroding the foundations of human survival on our planet. And that brings us to the second premise, which is that economic growth undermines planetary health. So there are a lot of folks who are very optimistic that green growth is going to be possible. And that would be great if it turns out that we can do that and we can continue to grow our economies and we don't really have to change the way that we're living. But I think there's enough evidence out there that it's going to be exceptionally difficult to actually decouple economic growth from environmental devastation on a planetary scale. So we need to consider that it might not be possible to achieve green growth, and that we might have to really fundamentally alter the way that we interact with the planet and the way we structure our economies. A global scale transition towards a post-growth political economy that would value sufficient use of materials and energy instead of endless economic growth would allow us potentially to step back from ecological overshoot and live once again within planetary boundaries. And the third premise that guides my work and my perspective is that it is possible to steward social ecological systems change to secure planetary health over long time horizons. So in complex social ecological systems, there isn't a single source of top-down control. So it's not going to ever be simple to change the relationships, feedback patterns, or paradigms that govern the system as a whole. And due to very high levels of complexity, systems change processes are always going to be unpredictable, and our attempts to intervene can cause unintended consequences and counterintuitive results. However, as people and communities and organizations, we're part of the self-organization of the living systems within which we exist. And in this way, we have some capacity to steward the process of change. But doing this will depend on our ability to work with the dynamics of complex systems as transitions unfold around us. So let's dive a little bit deeper into the ecological foundations of health. So human health is dependent upon planetary health, but we currently find ourselves in a paradoxical situation when it comes to health outcomes. Since the transition or since 1950, metrics of human health have steadily increased. So more than half of the global population has been lifted out of extreme poverty. Life expectancies have increased by over 25 years, and the infant mortality rate has fallen from 225 out of 1,000 live births to 45. So these are all incredibly positive things for people all around the world. However, the same drivers that are responsible for these gains in human health, primarily the modernization of our societies, which is coupled with an expansion in the scope and scale of our economies, has had a devastating impact on planetary health, to the point where air pollution, heat waves, wildfires are threatening human health around the world every day. As well as kind of jeopardizing our long-term survival on this planet. So if we take this idea seriously, that human health depends on the health of our planet, it raises some wicked problems. One is that there's an inherent tension between maximizing the health of a single species over the health of biodiverse integrated ecosystems as a whole. So attending to this human scale over all others is partly what has resulted in the emergence of health problems at higher scales, like climate change. Another wicked problem is that transitioning towards health systems that truly prioritize population health over individual health is going to require very fundamental changes to the kinds of commitments, worldviews, that we have in our society, because they are so different from the mainstream. And also, securing planetary health is far beyond the scope of healthcare systems alone. This is about changes at the level of the political economy, the way we organize our societies, the way we structure our cities, our cultural worldviews, and our interactions with the ecosystems around us. So around the world, we've been pursuing economic growth as a primary strategy for securing human health and well-being since the Industrial Revolution. So it's been quite a long time now. And we still hear this all the time in common discourse, that we just need growth again and everybody's lives are going to be better. But the ecological ecologically devastating impacts of growth on planetary health make the transition to some form of post-growth future necessary and fairly urgent at this point. However, moving to this post-growth future is going to be fairly difficult for health systems. Modern scientific medicine is generally seen to be one of humanity's greatest achievements. And I think we can all agree that we wouldn't want to live in a world without access to hospitals and dentists. We really like them. Antibiotics, if you think of how many times your kids have been sick, like we don't want to live in a world without antibiotics. But modern health systems, they emerged within growth economies, they contribute towards economic growth, and they're very dependent upon it. And this is even stronger given the rising costs of aging populations and an increasing trend towards high-tech solutions and professionalized care. So if we can imagine that we have a world where our economy is shrinking, we can expect decreases in complexity across all sectors of society, and this would also affect health systems. So we might see a reduction in the scope and scale of the kinds of treatments, technologies, professional specialties that might be available through healthcare. These changes aren't going to be easy, especially if they're forced upon us instead of kind of intentionally designed over time. And we might see initiatives that currently exist on the margins of health systems taking on a greater role in supporting our health and well-being. Extracting health systems from their dependence on growth is going to require a significant restructuring of welfare states as well, which since the end of the Second World War have been providing for things like public education, social security, healthcare, by taxing growth. Maintaining the health outcomes that we've come to expect in our modern societies is going to require an expansion in the scope of and availability of low cost and low throughput approaches like robust public health measures, dietary interventions, appropriate technologies, informal networks of care, and cultural meaning frameworks that support greater acceptance of living with illnesses and even of death. So what we're really talking about here is how health systems are going to transform alongside the broader transformation of the social ecological regime as a whole. So complex systems will seek a steady state. And this diagram shows those steady states as a basin of attraction. So it kind of pulls all the dynamics and feedback patterns of the system into one place and holds it in position. But internal crises within the system can make that basin less durable. An internal crisis might be kind of unprecedented levels of economic inequity, for example. And then external shocks, things like extreme weather events caused by climate change, they can also make the thresholds between basins of attraction less resilient over time. And this can make it more likely that the system as a whole will transition into a new stable state. So because of the extreme levels of complexity within our social ecological system, there are so many possibilities of where the system could go. However, let's just think about two for the purposes of our conversation. There is a chance that we could fall into this basin of collapse, and that would be kind of the full-scale disintegration of our social systems as we understand them today. Our governments, our ecosystems, our global networks for transportation of goods around the world. And we absolutely want to avoid going into this basin of collapse. This is like the future imagined by dystopian fiction writers. And although I think it's important to recognize that there are lots of people in the world right now who do exist in conditions of collapse, we absolutely don't want to go there all together as a world all at once, because it would be exceptionally difficult to get out of that basin once we're there. So what we want to aim for is moving into a basin of alternative modernity, or what we could say in a simple way, a sustainable society. So this is a place where we preserve a lot of the gains that we've won over the time when our societies have modernized. And, Western biomedicine has gained a lot of capacity. So we could keep that in an alternative modernity, but drastically reduce our ecological footprint so that we are living within planetary boundaries. So when we think about what health systems can do to support this transition towards a benevolent future, one of the main things is to support the self-organization of community-based alternatives for health and care. I think so many of these alternatives already exist on the margins of health systems, but within the current regime, they're never going to gain a lot of traction. And this is because the conditions aren't right for them. But as the system transitions into a new state, they could rapidly gather momentum and gain ground. So I'm a gardener, so I like to use gardening metaphors. So I like to think of these alternatives as little seeds that exist within the seed bank in the soil. And right now, a lot of those seeds might be dormant or they might just be starting to sprout. But then you have a huge, old, massive tree that comes down in a windstorm. And suddenly these seeds are getting light and they're getting rain, and the tree starts to decompose, release its resources and the roots of these, and all of a sudden we have this huge growth of biodiverse new garden of alternatives. Okay. So there's just a lag. Okay. The relational alternatives that I have studied in my research have a few common characteristics. First, they generate synergistic benefit just looking at the health of human bodies, but are also attending to the health of communities and ecosystems. They also embody ways of thinking and acting with the potential to disrupt the trajectories of the Anthropocene. So they aren't just operating in the kinds of worldviews that are going to lead us back into the problems that we have today. They're fundamentally that can take us somewhere new. They also achieve positive health outcomes at a low ecological and economic cost, so they're well suited to a world of more constrained resources. And they re-embed aspects of health and care in networks of family and community reciprocity. So they're cultivating those relationships in many different ways that can sustain health over the long term. Okay, and now I will present a few alternatives as examples. And I'm sure that lots of you in the room and online today have many more examples that you can share that are part of your work. This is the more hopeful, fun part of the presentation. We'll be done with the challenges for now. So care farming is a multifunctional approach to agriculture. I spoke with care farmers in the Netherlands primarily, and in this model, farmers will invite people who have different types of disabilities or mental illnesses onto the farm to become part of the farming team. So people will do things like muck out the stalls in the barn, they'll plant crops, they'll harvest crops, they'll work in little farm shops. And by creating these kinds of relationships to orient people's lives, this is what actually generates the health outcomes. And in the Netherlands, this model has really rapidly gained ground as a de-institutionalized kind of approach to mental health care. And there are about 1,300 care farms likely in the Netherlands. And it's a very kind of non-medical approach to healthcare, but it generates really incredible results. There's a lot of evaluations of this practice out there that I would encourage you to look at. Another example is the soil health movement. I think lots of people wouldn't even see this as connected with our health systems, but I think it's actually very relevant. The UN estimates that around 3 billion people are affected by soil degradation, soil loss around the world. And the soil health movement has significant potential to improve global health and sustainability by reinvigorating the vital planetary function that soils play in our lives. This movement tends to be led by regenerative farmers, though it's also practiced by gardeners and others who are caring for the land. There are a range of soil health principles, things like keeping live roots in the ground and minimizing soil disturbance. So that would be a no-till approach to agriculture. And this has been shown to improve plant and animal health, make crops and livestock more resistant to diseases and insect pressures, and then enhance the resilience of the land to flooding, drought, runoff, and different forms of erosion. So Didi Pershaus, who's a leader in the soil health movement, talks about building a soil sponge as working with the diligent and overlooked workers who are within the soil. These are the microbes and fungi that exist within the soil. And I love this metaphor and this example because it shows how working on developing relationships at the smallest scale where we can't even see, but it's in the ground beneath our feet, and everybody can support soil health, can actually have planetary level health impacts at the highest scale. Another example is community nursing. So in this model, communities will fundraise for a nurse to look after vulnerable people within their local communities. And this example is a really interesting way that professional medical expertise can be integrated into informal networks of care. So the nurse will be hired to look after a bunch of elders who are deciding to live in place, not go into kind of an institutional setting as they age. And the nurse will help them to connect into resources that are available. She'll come into their homes and help them put in banisters so that they can get around in their homes more easily and avoid falls. And this approach kind of takes the pressure off of the families and friends and neighbors that are supporting elders. And in this way, it's very cost effective because it doesn't cost a lot to hire a part-time nurse, especially when it's done in this collective way. And it really helps the networks of caregivers to continue providing their kind of more informal support to the people that they love around them. Another example is community care for mental illness in Geel, Belgium. So Geel is probably one of the oldest therapeutic communities in Europe. It's about 700 years old, and this model is rooted within Catholic traditions. So families take in boarders who are often people with long-term mental illnesses or psychiatric disabilities. And they're not treated as patients, but as valued members of the family. Boarders will often live with their host families for many decades. The average tenure in the program is 30 years. And this is a non-medical and non-institutional community-based approach to mental health care. So the families have access to a network of health practitioners, which has psychiatrists, nurses, general practitioners, as well as a psychiatric hospital that's in the community. So they have access to that care whenever they need it, but the health professionals don't intervene in the course of family life typically, and a common sense approach to care prevails. This model has been shown to be extraordinarily effective, prioritizing dignity, the value of real relationships, and a family-oriented approach to mental health care. Families are compensated by the state for taking in a boarder, so they receive around 500 euros a month. And this is about a sixth of the cost of hospital care, or about half the cost of other supportive living arrangements. So I think, although this model is very difficult to transplant somewhere else, it shows us some principles for how we might care for folks with mental illness in a more a world of more constrained resources. And then gardening for planetary health. This one is very close to my heart and is the direction of a lot of the work that I'm doing now. From an ecological perspective, home gardens have a lot of potential to have meaningful ecosystems level impacts. If you think of low density urban areas, places like the community that I live in Waterloo, between 25 and 30% of the land is people's yards. So their lawns and gardens, driveways, this kind of thing. So gardening for planetary health in an intentional way can contribute to building a healthy soil sponge, moderating the climate around people's homes, improving the water cycle, and enhancing biodiversity by creating habitat corridors that enable ecosystem regeneration, bring back native plants into the landscape, and support pollinators and mammals and all the biodiverse life with it that once was here in our cities and that have kind of been forced off into the margins. When integrated within formal healthcare settings, gardens can also become places for community members to gather, share food, and connect with nature. Jane Myatt, who's a family physician working in London, created a garden called the Listening Space in her practice. And she found that this space allowed doctors and patients to come together in new ways and subvert the status quo in medicine. So they could have different types of conversations when they were sitting in the garden than they would in the clinic. They would hold seasonal celebrations in the Listening Space garden that brought community together in an area of London that had a lot of income disparity and cultural diversity. And this garden became even more important during the pandemic as a place for people to gather and come together during social distancing. Of course, gardening can also contribute to physical health by getting people outside and active, and mental health by promoting connection to nature. Community gardens address social inclusion. So this approach really operates across scales in many different ways. So with some of these stories in mind, and I'm sure you're thinking of others as well from your own research and practice, I'd like to return to the topic of health systems transformation and what health system that can cultivate planetary health in a post-growth future might look like. So first, we might see a health system with greater capacity in prevention and primary care. As I was talking about earlier, in a degrowth context, formal healthcare systems might not be able to maintain some of the levels of technological intervention and professionalized care that we see today. But healthcare is typically seen to be responsible for about 5 to 20% of human health outcomes. So there is a lot of potential for healthcare systems to continue to offer robust universal healthcare services like emergency medicine, primary care, all these things that biomedicine does exceptionally well that we don't want to let go of. If we prioritize prevention and primary care, our health system will still function quite well. Secondly, we could see increased investment in the social and ecological determinants of health. So social determinants of health are probably, the research shows they're responsible for between 30 and 55% of health outcomes. So we might see a shift away from investing in medical research and technology development, which contributes to growth, but doesn't really contribute other than incrementally to human health outcomes. And instead, we might see initiatives like affordable housing, universal basic income, ecological restoration, and poverty alleviation, which would contribute much more directly toward planetary health outcomes. The next thing that we would want to support is thriving networks of contextually whole health and care initiatives that are looking at health from a cross-scale perspective. So these are the types of relational approaches that I discussed today in the presentation. And what I mean by contextually whole is that they arise or they're grounded in the social and historical conditions within which they have emerged. So things like Geel, you can't just pick that up and put that model somewhere else and expect it to work. And that's been tried, like, because it's such an amazing example that people have tried to do that in other places, and typically it doesn't work. But there are going to be local community-based initiatives within each community that are already there, that are kind of small even, but they're functioning at a local level. And those are the ones that, if we kind of support them to develop, are likely to be successful within the context in which they arise. And then lastly, expanding livelihood opportunities related to health and care. So degrowth scholars often talk about how in a contracting economy, we would expect to see a lot more formal and informal roles in the realm of caregiving. So as the formal economy contracts and people aren't spending the majority of their time in paid employment, we would expect things like caring for children, caring for elders, caring for people who have mental illnesses to benefit from people's time and energy that is freed up to support those types of things. And in the transition, we might also see things like growing preventative medicines, exercising, and making things, cooking, provisioning for our daily needs to become a much bigger part of people's lives. So these activities are likely to give people a greater sense of meaning and well-being in their lives than kind of working in the formal economy in the way that we do today. So this could create a positive feedback loop where the more people are supporting the health and well-being of their communities and the planet, the more their individual well-being increases. I think I will leave it there on that positive note. Thank you so much for listening today.
Thanks, folks. So I'm looking for questions from the audience, and I'm happy to get started. I'm looking at Edward. He looks like he's ready already. Are you ready, Edward? Okay, good.
I have a head start on this because Katharine and I had a conversation a while ago, but thank you so much for this presentation. Really interesting to hear the ideas again. So my question is about who should be leading these transformative changes. I'm thinking about some instances I've seen where there's co-option of the concept of planetary health, or use of words like transformation as a metaphor, and this co-option is kind of shifting the idea of planetary health from health to healthcare, or from equity and towards maximization of health. So I'm wondering who should be leading these changes.
Well, I think everyone, for lack of a more complex answer. Like, I think there's a lot to be said for the initiatives really emerging on the ground. And so those would be led by community leaders and also by people who have experience within healthcare systems. So in my research, there were a lot of initiatives that were led by people with experience in the mental health system, for example. So I think the more that we can see co-design of initiatives, the more likely they're going to be effective. I don't think that it hurts to try to have kind of governance approaches as well. But like you say, like the co-optation is, there's such a risk of that. And then also of unintended consequences where, you're trying to intervene in the system and you create this kind of intervention, but then it circles back and turns out now we're just, doing more. We're just contributing more to growth. And I think there's a lot of that. So I agree that that's a challenge. I don't know if that answers the question, but thank you.
Can I ask a question? Can you speak to this concept of prefigurative efforts, what that means just generally, so we're all sort of on the same page, and what is it that we think we're doing with the sort of prefigurative efforts? Could you speak to that?
Yeah, so prefigurative, it kind of means that they're embodying the transformed system in the present. So they're kind of operating from practices and worldviews that might function better in a transformed society. And in doing that, they're making it more likely that that society will kind of come about. So, a very simple example would be something like co-ops, like cooperative ownership of homes, where that's not really the way we tend to organize property, but it kind of prefigures a different type of economic system. And in doing that, it gathers momentum around itself. That's how I understand prefigurative alternatives.
Right. And you're listing some that you think sort of already exist. I mean, as you were talking about all those examples, there was a little bit of chat. And I myself, I'm trying to think about what are not that the local is everything, but the local is key in a way. What are the local variations on broader themes? What role, if any, could we have as an academic unit in connecting to those initiatives? Because as you said, that sort of, it is a very exciting sort of possibility in the context of things that are quite dispiriting, but it makes sense. Like, it makes sense from a political science perspective. You would talk about this as, creating the policy package and waiting for the window of opportunity but you need to work it out. You need to figure out what it looks like in practice. Like, how do you do this? And then, unless you've got an established, quite practical model of the thing that would be there's that window of opportunity just passes you by because somebody else has got something else to. So it makes a lot of sense from, I think, multiple different kind of perspectives, but it just begs the question as to whether we know. So here's my question, I guess. Do we know about, is anybody mapping, in a sense, the range of these kinds of efforts that exist? Is there a way for us to identify them, engage with them, or is part of the issue they don't name themselves? They don't use the same language. They don't use the same terms. It becomes this imposition. And Varden knows what I'm talking about here.
Yeah, I think that's a really interesting question. And that was sort of what my work was aiming to do, was to map the landscape of these kinds of initiatives. And a lot of the ones that I looked at were local to Canada, and others were kind of in Europe or in the UK. But sometimes when I would talk to people, it was really interesting because I would say, this has very significant planetary health impacts potentially. And they would have never thought of that. Like, the care farmers are not thinking, they are thinking about how, now they can use organic methods because they have more handwork in the farm that allows them to work in different ways. They're thinking about all of those things, but they're not necessarily bringing it together and associating across different initiatives. But I think there are a lot of people who are working in those spaces who are up for that kind of systems kind of conversation. And so just connecting with people and talking to them and saying, have you ever thought about how this actually at scale has really significant potential? I think we need a more community grounded type of academic space to be able to do that, because people are not necessarily interested in like a real academic type conversation, right? We need to connect with people in a more engaging and human way, possibly.
I just wanted to ask, and I think this is related to how we maybe characterize initiatives like this, because I could think of a world in which you think of these as building climate resilience. I don't hear you using the word resilience, and I'm wondering if that's intentional or what you make about that word in all of this.
Yeah, I like the word resilience. I think it didn't make it into this presentation, but it's definitely in the book. I agree. Yeah, they are all contributing to resilience, and that's part of it's kind of trying to map this new system before it exists. It's like that all the prefigurative alternatives provide some resilience if the system moves in that direction. So yeah, I think on board with that.
We do have a couple of folks, some strong questions online. I wonder, Donald Cole and then Samantha Green, if you'd be up for unmuting yourself to offer us your question.
Sure. Katharine, I'm calling in from our son's ecological farm. being a retired professor of public health. So a lot of your ideas really resonate. But one was a kind of, I felt, wishful thinking that with transformation and, downsizing the economy and all that kind of thing, we're going to actually have more time for care. And I say that because historically, over the last, let's say 50, 60 years, under the form of capitalism we have and political economy we have, the end of work, Jeremy Rifkin, has not occurred. The Great Cold War dividend in terms of peace and more resources and people not having to do as much has not occurred. So, what do you think needs to be put in place to prevent that kind of sucking up of the resources and a transformation that, in fact, increases inequalities and does not permit this kind of widespread nature of, great initiatives, but not policy supported, as you pointed out. They're just kind of great examples, but they're not mainstream policy. What do you think needs to be put in place to move towards that so there's a more equal opportunity for that kind of future world?
Yeah, so I think you're right that even when we think about the recovery from the pandemic, I think there were so many possibilities that we saw and none of them happened. And now we're kind of seeing a rebound where everything is just like becoming more inequitable and life is more expensive and people are working harder. So I completely see where you're coming from. I don't know. I think it is overly optimistic maybe to think that, okay, health system capacity diminishes. One easy thing we could do is put in place a universal basic income. If we did that, so many pressures would be relieved from health systems. If there was more actual affordable housing, and that was supported in policy in a better way than it is now. Those types of things, I think, especially the universal basic income, which would kind of free up people to not have to be working these intense jobs that are kind of just like busy work in the economy that we have that might not exist in the future. So, but in terms of how we get our governments to support these obvious initiatives that we have known for decades are what is going to help, I don't know that. I'm not a policy implementation expert. I would have to leave that to somebody else of how you get those things actually into the policy space.
Thanks.
Melanie, I saw you were you going to ask something?
Yeah, actually. As you were kind of going through these different examples, you kind of talk about how they're able to create better health outcomes and better ecological outcomes in this resource restricted environment. But I'm wondering if you have any thoughts on how these different initiatives are actually able to like free up or even redistribute resources, whether, monetarily or even just like raw resources like food and water and things like that.
Yeah, I think the example that comes to mind is care farming. So in the Netherlands, the reason that initiative became really kind of popular was it kind of intersected with these different goals of the agricultural sector and the health sector all at the same time, and did kind of do that redistribution of resources. So at the time, they were looking to deinstitutionalize care, and they came up with this idea of like personal budgets for health. So people could choose where they spent their money that they received from the government for social care. So people really liked being on the farm. And so the resources started flowing there, and that became a new income stream for farmers. So now, like, all these family farms were kind of losing out to industrial agriculture and being forced to sell, and they didn't want to do that because they were family farms.
So with this kind of redistribution of resources from the state into agriculture, then they could keep their farms. They started producing organic food that went into the community and taking on this social care role. So I think that's likely an example of that. And you would see that in lots of the initiatives as well. Yeah.
I'm just going to jump in. We'll keep doing so, but that's such a fascinating example, and it answers in some ways. I mean, Samantha, you've got a question here. I don't know if you want to articulate it, but it follows a little bit from what Donald was doing and asking in your answer. Like, we'd look to the policy experts who would also throw up their hands and say no, but they would. But the example you just gave is such an interesting one of the practical ways in which you can align initiatives. And what's interesting to me also is that oftentimes his personal budgets for health, it's caught a little bit in the tension between, on the one hand, absolutely valorizing the client and consumer as the expert in their care, and the way in which it also aligns a little bit with neoliberal dialogues about healthcare and choice and things. So it's such an interesting example that, you know, when we maybe this is relational approaches, I actually don't know, but when we try and put these things together, you have this practical way forward. Because I don't think there is any like policy decision that's going to be made that moves us in those directions, which is, I guess, why the prefigurative is so important, is how do we, in the spaces that we have, enact alternative futures? Like, how do we do it now? How do we line up the discordant bits of policy and opportunity and organizational intent that can move us forward? Which returns me back to, like, what are the practical examples that are happening now? But maybe I won't reiterate that. Can I ask a different question? So you made a comment about green growth. And you sort of said, wouldn't it be nice if that would happen? But, and so, for those of us here in Toronto, Bill McKibben is speaking on Monday afternoon through the School of the Environment with his Here Comes the Sun, which is a full-on techno-optimist book, right? In every way, shape, and form. In terms of solar, the electrification through solar and electric cars and transmission and all this, it's a mature technology. China has innovated, and principally China, we do have something that's an innovation in the truest sense. It works, it's good, and it's cheap. Like, what an economist would truly say innovation is, it's better and cheaper. Mm-hmm. And they've done that. The geopolitics make it tricky. We can't buy their EV cars here, or at least they're too expensive. But it's a very techno-optimist vision. So my question, I guess, is, how do we deal with that? Because on the one hand, we can say, I think, as you said, that's great. Keep working on that vision, because if it works out well, then we're all fine. Meanwhile, we've got to work on something else because we're not convinced that's going to happen. Or you sort of say, there's problems with your techno-optimist vision. These are the problems. So there's a lot of the degrowth scholars that are explicitly writing against, arguing against the green growth vision and sort of saying why it can't work, what the evidence shows. Mm-hmm. And I'm a little bit torn between these two poles of sort of allowing it in a way and saying, well, that's fine, and I'm not going to pay any attention, or if that's what you're saying, or actually sort of articulating an opposition to that vision. So mm-hmm. where do you think we should go on that one?
I'm torn as well. Because I think the world that degrowth scholars are kind of trying to envision, I don't think we're going to try that. Like, I don't think we're going to try an intentional degrowth approach. It's just not going to happen. We don't see any evidence that anybody in a mainstream sense in politics or economics is ever going to try an intentionally designed step down. So in that context, I would think, let people try the techno-optimist future. I don't think it means we don't raise opposition, but I think the danger is that in kind of catastrophizing, we kind of, we scare people. And then it just makes them psychologically hold on to the status quo harder and rationalize the existing system harder. I think there's some traction around framing ecological problems as health problems because people care about health. They don't really care about ecosystem collapse. I mean, some people do, we all do, but lots of people can't engage with that narrative, or it's too bound up with other types of political commitments that are just too difficult for them to get on board with. So my sense is that many approaches at this time, like we are in a time of crisis, and this is the approach that I think I want to devote my energy towards, but I wouldn't discourage others who are trying to bring about a better world from devoting their energies to what they think is going to be.
Samantha has got her hand up. Samantha Green, please.
Yes, sorry, I'm walking to clinic. And I know I just see we're short on time, but actually related to my previous question in the chat about how do we actually like politically enact all of these things? I'm also curious, how do we ensure with these relational approaches, I really liked all the examples, how do we ensure that the most marginalized are included? Because just, thinking about, each of your examples, and I'm walking to a women's shelter right now to provide primary care, and how would they get connected with some of these like farming projects, for example? How do we make sure that like these projects are universal and that the most marginalized can participate?
Yeah, I think that's an excellent question. I think that a lot of the initiatives do kind of incorporate quite marginalized people, but of course there would be folks who are left out. I think we need to kind of build skills in co-design across the board. So leaders who are kind of working within those movements to bring in the lived experience of people who are using all of these services and initiatives, so that they're designed with the most vulnerable community members in mind, and then can more easily support their needs. And that's, I think, something that can happen at a very local level. Lots of people who are leading these initiatives do have those skills, but there's probably opportunities for skill building around facilitation and community inclusion and co-design.
Okay, Edward, you have the last question.
Okay, thanks. It was related to, I guess, both of these. It's around like the political economy of this. I think the abundance agenda has really captured people's imaginations. I think Bill McKibben aligns with that, Ezra Klein, Matthew Huber, these kinds of people. And it's, talking about material conditions and improving material outcomes. And even, people like Jason Hickel have kind of softened their tone on how to tackle degrowth in the politics. I'm wondering, the forms of relational care that you're talking about, can they be framed in terms of an abundance agenda, or can that make it more politically attractive, I guess, in the current environment?
Yeah, I think they could be. I think they can be framed in kind of an abundance of the things that really matter in life. Social relationships. Like, there's so much research that shows that social isolation is like the worst thing for our health. So if we can talk about abundance of meaningful relationships, abundance of like local nutritious food, abundance of time in nature. I don't know if that really intersects with those agendas, but I believe it could. Like, those are the things that matter to people in their lives in terms of their well-being. So they might not be abundance of material resources necessarily, but I think they can intersect there with some good writing and speak.
Okay, that's work to be done. Well, wonderful. That brings us to the end of our hour. Thank you, everybody, for joining us in person and online.